Fascial restrictions around the anterior wall of the vaginal canal can significantly impact your overall pleasure experience during partnered intimacy and even intimacy with yourself. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and co-founder of the Vagina Docs. And in this video, I'm gonna go over a technique that you can do on your own to open up the fascia around the internal portion of the clitoris so that you can experience more pleasure during individual intimacy and partnered intimacy. What would cause restrictions around the clitoral region? A lot of things. Anything from a history of UTIs, vaginal deliveries, cesarean deliveries where the scar is in the lower portion of in the pelvic brim, that can extend into the anterior vaginal canal and the rest of the pelvic floor. Tearing during vaginal deliveries that extends upward or backwards. We have slips of muscle that are all interwoven and interconnected by fascia. If one area becomes restricted, it can create tension on other areas. Other traumas like falling on a gymnastics beam, falling down the stairs, being kicked between your legs like I have numerous times when I played soccer and basketball. Really, any sort of trauma can create fascial restrictions. Any infections like UTIs, STIs, any GI inflammation. The gut sits very close to the bladder neck, and the clitoris is close neighbors with the GI tract and the bladder. Any inflammation downstairs around the pelvis can ultimately lead to fascial restrictions. If we don't address the fascial restrictions, they can build over time and then restrict blood flow, nerve function, and overall muscular function. Before I dive into the myofascial release technique to open up the anterior wall, let me quickly go over very basic anatomy of the clitoris. So what you see in this model, that yellow dot, that is the external portion of the clitoris that's depicted by this model. The internal portion of the clitoris is a lot bigger, and through our fascial technique, we are really targeting that area. The internal portion of the clitoris lays on the front side or the anterior vaginal wall, the underside, and it's anchored by certain muscles or portions of certain muscles within the pelvic floor muscles, the muscle group, which is what you see here. As always, it's super helpful to be assessed by a professional. Downstairs is like a black box, and I have my patients even go through their own pelvic floor exam to help them understand what I'm doing, as well as to get the most out of their self-treatment techniques on their own. And it's helpful to compare your results with your pelvic floor physical therapist results. So do try to connect with a pelvic floor physical therapist so you can have yearly checkups or 2 checkups a year so that you know that you're doing the right things to move your pelvic health forward. And that's super important because as women, we go through so many transitions just in a given month with our cycle, and then so many transitions across our lifetime. So do keep in mind, see someone, but for at home, how to do this, to perform this simple myofascial release technique, you are going to take either 1 or 2 hands. If you take a look here, this is the clitoral hood or the tissue that protects the actual clitoris. You will take 1 or 2 hands on either side or just above. You're gonna sink into the skin until you feel a little bit of resistance of that tissue pushing back at you, so it's not super hard. If you go hard, you're gonna actually press through the tissue. Once you sink in gently, then you're gonna pull upward until you start to feel a little or a gentle stretch or resistance in the tissue as you're pulling upward, and you're just going to hold that. Now, myofascial release principles have shown us that a minimum of a 5 to 7 minute hold is necessary for the actual metabolic changes in the tissue so that you have sustainable changes and it doesn't just go back to where it was before you did the technique, like some of the massage techniques. So you will pull up and you're gonna hold for 5 to 7 minutes. In that time, you wanna stay present with what you're doing. You may feel the tissue heat underneath your fingers. As it softens, you want to just follow wherever it goes. Now this takes some practice in developing that tactile familiarity of what to do when things happen. So generally speaking, look for heat or movement and just follow that. That movement can go anywhere. It can be moved to the laterally, it can move upward, it can move lateral and up. So just try not to overthink it and just follow. Other directions you can check lateral in just directly lateral from your anchor point. You can go lateral into a diagonal up or the other way, but basically you're assessing what side or what direction is tighter, and you're waiting. You can choose the tighter side, hold that, and then do the other side after that. Generally speaking, what I tell my patients is, because everyone tells me that they don't have time, but start with one direction 5 minutes, or that first time try 2 directions. 2 directions is helpful so you can have a comparison, because sometimes you're just not sure, you might be pulling on a side that actually doesn't need it, and therefore it's helpful to have another direction and say, oh yeah, I definitely noticed the difference between that direction compared to the other. And then typically what I have my patients, everyone's gonna be different, but depending on the chronicity or how long it's been since they've had that initial trauma, or however long they've had the issues for, I'll say daily to every other day to a couple times a week. And each session aim for 5 to 15 minutes. If you notice that you have sensations elsewhere, that's not uncommon. Myofascial release is super gentle, that the actual techniques, when performed properly, will never injure you. So if you do notice some discomfort or pain, be keenly aware, like it shouldn't be harmful pain. If it is harmful pain, you're pulling too much. But it can be therapeutic pain where, it might bring up tissue memories. It may, the nerve that's restricted in that tissue may refer elsewhere. It could be laterally into the groin or the hip. It could be into the part of the back, or it could be into the leg. So those are things just to look out for. You may not feel any of that. You might feel a light heat. Everyone's experience is going to be different. So in this video, we covered potential restrictions around the clitoris affecting your overall pleasure experience, and I didn't mention this, but orgasm as well. We talked about what could lead to restrictions around the clitoral region, and then we talked about anatomy, and then went over the myofascial release technique. If you have any questions about anything I covered in this video, comment below or reach out directly. Otherwise, thank you so much for watching. Be sure to subscribe and like the video, and then I will see you on the next video.